If you guys attended one of the first or second blockchains we had, summits we had, this is the fourth one. I don't like to say that because it sounds cool. But you know, as far as actually validated working things happening, you know, there just wasn't as much on the enterprise side. And so I think it's really exciting to have you guys here today, because we only have that 20 minutes. We want to get you started right away. So we're actually starting 30 seconds over.
Perfect.
And kick in if you could do introductions, and then everybody will remember, and kick right in.
Cool.
Thank you.
Thank you. So I'll start off really quickly and introduce myself, and then I'm going to do as little talking as possible. My name is Hartley. I run corporate development for BurstIQ. We are a global health data network. We allow for on-chain data management with complex ownership of data and complex consent. So we allow people to truly own in a very meaningful way their data from any source across the healthcare ecosystem, whether that's your traditional EMR, IoT device, we connect supply chain, manufacturing, pharma, all of those connect together. All of that data to exist within a broad network and really connected so that you can start to achieve the true vision of personalized medicine and person-centric care. So really, BurstIQ is an infrastructure platform. We allow for data connectivity across the healthcare ecosystem. And really, where you see BurstIQ platform really come alive is in the services and the applications and the new wave of technology that is really enabling the vision of person-centric care. And all of those services and applications that are on top of us, those are how the BurstIQ platform really manifests. And so we felt that it was, you know, we would much rather talk about the amazing things that people are doing on the platform than ourselves. So I want to introduce these three amazing people. So we have Travis James, who's the CEO of Tribe Health. We have Kevin Krauth, who's the CEO of Orderly, and Justice Schaper, who's the CTO of Empiric Health. And I pass it along and let you guys, first of all, introduce yourselves and what your company does and how you guys are using blockchain.
More about quality and search and performance variants. But if we are in the room with the Chief Technology Officer, in particular the Information Security Officer, then we'll go a little deeper. And that's more often when the blockchain piece will come up. Usually more from a standpoint of curiosity and interest at this point. I think, again, the healthcare legacy technology systems do tend to lag a little bit. And so blockchain is certainly, people understand it, but it's not part of the inherent technical infrastructure built out within most of these systems at this point.
Yeah, I mean, I think, so for starters, our main customers are health insurers, which, you know, I mean, everybody, it's funny because if you talk to anybody in the healthcare space, they say, like, the stakeholders are, well, you can't sell to consumers, you can't sell to patients in healthcare, and you shouldn't sell to hospital systems because they're impossible, and you shouldn't sell to health insurers because they're impossible, so you're just sort of like, don't go to healthcare. That's the lesson. But no, I mean, just like any other sale, I mean, I think, obviously, to Justin's point, I think the sales cycle is complex, there's complexity with it. You have to understand the stakeholders, and I think, but with any sale, it's more about the person you're selling to and the problems that they have, these solutions that you can offer, rather than presenting what it is that you can do right off the bat, right? And trying to start by saying, you know, what is it that you guys are really struggling with, and sort of framing it around, I always call it the inception model, make it seem like it's their idea, like, oh, do you have any problems with provider directory data? Oh yeah, you know, and then they kind of walk through and frame the problem, and you say, what if you could do something like this? So layering on blockchain, I think if you were to drop the term blockchain too early, you might scare people away, or maybe, I don't know, with a hype cycle, maybe that's the best thing ever, you drop it in. But I think for us, we always try to be really opportunistic. We frame the conversation around the problems that they have, and then understanding our audience, we can talk a little bit more about the technology that we're using that separates us from our competitors.
Well, while our solution depends heavily on distributed ledger technology and blockchain, I never mentioned it first. The thing that I mentioned first is the pain point that they have. I try to detect, first I try to learn from them to determine what are their pain points. And a lot of times they teach us what the market is. A great example of a meeting we just had in Mississippi just last week, where we come in, we talk about an imaging problems. They had those imaging problems, but you know what? They have a regulatory requirement coming up next month where they have to provide a patient healthcare record integration as part of the new laws coming from the new regulations coming from the CMS. And it turns out that our platform is perfect for providing that integration in a way that is less expensive for them. They were considering integrating directly with Apple Health, and then that would only cover a certain number of patients. And it would be difficult to get the right code that we've already written. So in that case, we actually were able to detect that as a distinct pain point for them and pivot to determine that we can provide an entry point for them that is comfortable and led by a mandate. Because what we've learned about healthcare, like you guys have probably learned, even with a terrific solution, healthcare, they just slow to adopt unless they're forced. And this is an area where they're being forced.
So I want to sort of add a little bit to that. You guys have a little bit of a different model. So you have a suite of products and services that you guys build and offer yourselves. You also offer custom development services as well. Is that right?
That's correct.
Yeah. So you've worked with a number of different blockchain protocols.
Yes.
And I'm curious to get your perspective on what have you seen in terms of how different blockchain protocols can be useful. Where do you see applicability of some of the public chains like Ethereum that you've been building on? Where do you see some of the value add of some of the private permission ones? How do you sort of see where all of these different blockchain platforms and protocols, where's their niche? Where do you see the greatest applicability, especially when it comes to healthcare, because that's what we're all in, but where do you see them really having the best fit?
Well, in our experience, we started, when we first started the idea for what we were going to build, before we knew about you guys, we were actually going to start on Hyperledger. I had to make a decision early on, based on my previous experience with blockchain solutions, that we knew we wanted to go with a permissioned blockchain. Obviously, a permissioned blockchain is closed, but it allows for us to control things like the rights management between owners, a user of the data, and the collaborator. So when it comes to the relation between that and public blockchains, we also have the performance issue. And then you have the issue of the development time it takes to build well-architected smart contracts that cover the types of functionality that you're trying to expose in the decentralized network. And those are the things, the problems that you guys saw about the gate for, specifically with how you handle consent contracts, how you handle the management of metadata for particular chains. All of that saved me a lot of time. And then it allows us to focus more on user experience, right? And focus more on solving pain points. And in which case later on, you can use your facilities as you all evolve to include integration with other chains.
Yeah, I was just going to ask you about that. Where have you seen good use cases for interoperability with other chains?
Well, I'm going to give you a good media example. There is a quote-unquote competitor of ours called MDW. You go to mdw.io. What they are is they provide a kind of an ecosystem around medical images to allow images to people to be compensated for selling images on their platforms and everything else. Well, they are, I believe they're an Ethereum-based platform, but we can integrate with them directly and treat them as a partner as opposed to a competitor. And because every others in the space are also similar, right? They are taking a different perspective on things, meaning that they're a public blockchain, so they're tied to the currency. I have found that that's difficult for adoption. It's difficult to get individual users onto a public blockchain, handling wallets and all these other type of complex constructs. I want to show them value first, and then introduce them into participating in the ecosystem using a cryptocurrency at some later date.
Awesome. So, Justin, I wanted to ask you, you guys focus on surgical optimization, but the methodology that you use could be applied in a number of other areas across the healthcare ecosystem. So I'm curious, how are you guys thinking about other areas in the workflow, the general sort of healthcare workflow? And are you planning on expanding into those areas? Are you staying with surgical? What are your thoughts on kind of how you expand and how you push into these other areas?
So most of the kind of innovation that Intermountain Healthcare, which is the healthcare system that we spun out of, where most of this methodology was developed at, was done in working very closely with surgeons. But the generalization of it was finding a way to group the medical data around procedural types of cases together using some data science so that you really end up with true comparisons. One of the other little challenges in healthcare is that when you go to try to analyze data, you think you've got two surgeries, for example, that are really the same kind of surgery, when in fact they're not. And you have to really get down into the nuances of things like the surgeon's operative note to really understand how that goes together. And so part of the innovation that we've done is solving that problem and bringing that together. We do think that translates into other procedural areas in healthcare, so things maybe outside of surgery. But really any point for us that is provider-centric, which is I think where actually some of the interesting collaboration opportunities come in, is that if we can really do the analysis to say comparing doctors to doctors on similar kinds of processes, where's the variance and then how can we act on that? Our main focus though is to go where our client's takes, and so that's where we expect to expand first.
And Kevin, that actually kind of leads me to a question for you, because Justin, you were talking about sort of the importance of the provider in all of that analysis, and that's what you guys do really well. And I think we're all kind of familiar with some of the early use cases of blockchain in the healthcare space was really around provider directories. There were kind of some actually very well publicized pilots around provider directories. Those seem to have sort of fizzled a little bit. And I'm curious to get your perspective on maybe why those things weren't really all that successful, and what you guys are doing a little bit differently from that, and also kind of how you see provider data more broadly kind of permeating healthcare, and where provider data really becomes essential in healthcare, because it's beyond just kind of a simple directory. Is that right?
Yeah, so I can't speak necessarily for why everything in the Synaptic, I think you're referring to Synaptic, the joint venture between, I think it was Humana, United, Quest, and a couple others. But I mean, from where we sit, I think one of the reasons why, even when I initially read that white paper, and I think they were talking at AHIP or JP Morgan or something like that, when I initially read about that, I was sort of like, I'll give this a year or two before we sort of see what actually happens. Because what ends up happening is that there's a lot of work that goes into cultivating the data, and then you share it on the blockchain, but then you have it's sort of classic free riders problem, right? Where you say, well, I don't necessarily want to arm my competitors with all the work that I just did in order for them to have their data correct, and then ultimately, we're United and Humana are in some ways competitors, and that I'm not picking on either of them, but I see that playing out in a number of different ways. And the thing that I think what we're doing that's somewhat different is that because we don't really have a dog in the fight for on the insurance side, we're not making money from having more providers that are exclusive to us. The way that we work is that by adding data to our system, we make it easier and we simplify the process of trying to update that data, and then there's network effects. So we can maintain the standard of being neutral. We're sort of a Switzerland in the space, and I think that's where blockchain can get really valuable, because if one aspect, even we were talking earlier before this panel, information that you gain, if we're collaborating, then I make a change, and then it propagates to the things that you need as well. And I think in that way, collaboration between various different vendors with a similar goal is going